the essential functions are assessment, policy, development, and assurance. And what I like to compare those three essential functions is to the clinical environment of the patient and doctor, and to the public health of the community and the health officer, if you will, or the health department. So assessment for the individual is taking a history and physical, maybe lab and so on, and then you decide, you determine what are the major problems for this person, right? The doctor does that. So in public health, it's the same concept, if you will, where we consider, okay, what are the data, what did the data tell us of deaths and hospitalizations and disease registries and outbreaks and so on. So we assess the data and we monitor periodically the community health, the health of the community, the public, and we publish that periodically. That's assessment. Then we find out, well, these are the major problems. So I like the county health rankings model of outcomes being death and disease and the factors that lead to health and disease, and that's where we can go upstream and improve those factors, and we'll have eventually less health and disease. We may require fewer hospital beds, fewer providers of care, and so on. But there are four groups of the socioeconomic, meaning better education, more education, which leads to better jobs. Behaviors, and behaviors are very tied to education, very much tied to education. And access to care, as we've already talked about a little bit. And then finally, the fourth is the physical environment. Parks and walkable streets and safe streets and the such. The little pockets they have of poverty, like in Marin or in San Mateo, for example, are much bigger out here.
Yeah.
And so we're much more rural, for example, much more spread out. For transportation to parks, etc., it's harder. The weather plays a bit of a role in the hot summer. In the cold winter, people don't get out as much as they might on the coast, where those extremes are less. So that's part of it. But the poverty and education might be the biggest differences. The population is much higher educated, higher incomes in the coastal counties versus the Central Valley counties. And so the heart disease and the smoking and the obesity and the diabetes and the cancer and all those chronic diseases, as well as others, are much higher over here.